Acquired Color Vision Deficiency by AZLAN ADNAN, M.A. Sunday, 14th of September, 2025. Introduction. Most of us take the ability to see colors for granted. The greens of trees, the blue of the sky, and the red of a traffic light seem simple and obvious. Yet for millions of people, colors do not appear as expected. This condition is known as color vision deficiency, CVD. The term CVD is now the preferred and more politically correct replacement for color blindness, which can be misleading because most people affected can still see colors, just not as accurately or vividly. Many are aware of the inherited type, present from birth and usually running in families. Less well known, but equally important, is acquired color vision deficiency. Unlike the inherited form, it develops later in life, often as a result of eye disease, neurological problems, certain medications, or exposure to toxins. Because it can signal underlying health issues, understanding acquired color vision deficiency is essential for both patients and healthcare providers. Physiology of color vision. To understand what happens when color vision is disturbed, it helps to know how it works in the first place. At the back of the eye is the retina, which contains two types of light-sensitive cells, rods and cones. Rods help us see in dim light, while cones are responsible for color vision and fine detail. There are three types of cones. S cones, short wavelength sensitive, peak sensitivity around 420 nanometers, nanometer, allowing us to see violet-blue light. M cones, medium wavelength sensitive, peak sensitivity around 534 nanometers, responsible for green vision. L cones, long wavelength sensitive, peak sensitivity around 564 nanometers, covering yellow-red light. Together, these cones send electrical signals through the optic nerve to the brain's visual centers. The brain processes these signals, allowing us to experience the rich spectrum of colors. Any disruption along this pathway, from the cones to the optic nerve to the brain, can interfere with color perception. Classification of color vision deficiency. Color vision deficiency can be divided into congenital, present at birth, and acquired forms. Congenital CVD is usually symmetrical in both eyes, remains stable throughout life, and most commonly affects red-green color discrimination. Acquired CVD, on the other hand, is often asymmetrical, worse in one eye, may progress or fluctuate, and can affect not only red-green but also blue-yellow color perception, or even cause a general reduction in color sensitivity. Recognizing this distinction is crucial, as acquired cases are often linked to disease processes that require medical attention. Causes of acquired CVD. Ocular causes. Age-related macular degeneration, AMD, damages the macula, the central part of the retina with the highest density of cone cells. As AMD progresses, it reduces the number of functioning cones, leading to faded, distorted, or missing colors in the center of vision. Retinal diseases such as diabetic retinopathy and retinal vein occlusion can also harm cone cells. Glaucoma affects the optic nerve, disrupting transmission of visual information, including color signals. Optic neuritis, often linked to multiple sclerosis, may produce sudden color desaturation. Cataracts scatter light entering the eye, often making colors appear dull or yellowed. Neurological causes. Stroke, tumors, or trauma affecting the occipital lobe or visual pathways can distort color processing. Multiple sclerosis may affect the optic nerves and cause fluctuating color loss. Systemic conditions. Diabetes and hypertension can damage small blood vessels in the retina, leading to color vision problems. Metabolic and toxic disorders may also interfere with cone or nerve function. Drug-induced causes. Certain medications are known to cause color vision changes. Ethambutol, used for tuberculosis, is strongly associated with optic nerve damage. Chloroquine and hydroxychloroquine, used for malaria and autoimmune diseases, can harm the retina. Digoxin, a heart medication, may cause yellow or green tinges to vision. Sildenafil, Viagra, can temporarily affect blue vision in some users. Occupational and environmental toxins. Chronic exposure to organic solvents, heavy metals, or industrial chemicals can damage retinal or neural tissue, leading to color vision loss. Clinical features of acquired CVD. Unlike congenital color blindness, which is lifelong and stable, acquired cases often show distinctive patterns. Onset may be sudden, as in optic neuritis, or gradual, as in glaucoma or AMD. Laterality may affect one eye more than the other. Associated symptoms often include blurred vision, reduced contrast sensitivity, eye pain, especially with optic neuritis, or central blind spots. Perception changes. Patients may notice that colors look washed out, dull, or have a brownish or yellowish tint. Such clues help distinguish acquired CVD from the congenital type. Diagnosis and testing. Patient history. Doctors begin by asking about onset, progression, drug use, occupational exposures, and associated symptoms. Screening tools. Ishihara plates, widely used and effective for detecting red-green congenital defects, but less sensitive for acquired forms. HRR, Hardy-Rand-Rittler plates, can detect both red-green and blue-yellow losses, making them more useful for acquired cases. City University test, a color matching test that identifies both congenital and acquired deficiencies. Farnsworth D15 test involves arranging 15 colored caps in sequence, useful for classifying type and severity. Tashra advanced testing. Farnsworth Munsell 100 hue test, a more detailed test of color discrimination, requiring patients to order 100 colored caps. Anomaloscope, the gold standard for measuring red-green vision loss, though mainly used in specialized clinics. Electrophysiology, tests such as electroretinography, ERG, and visual evoked potentials, VEP, can help pinpoint whether the problem lies in the retina, optic nerve, or brain. Because acquired CVD often signals underlying disease, systemic and ocular examinations are essential parts of diagnosis. Impact on daily life. Living with acquired color vision deficiency can be frustrating, especially when it develops suddenly after years of normal color perception. Occupational challenges. Jobs that rely on color discrimination, pilots, drivers, electricians, doctors, artists, may become difficult or impossible. Safety concerns. Traffic lights, warning signs, or medication packaging may be misinterpreted. Everyday activities. Choosing ripe fruit, matching clothing, or cooking meat to the right degree may cause difficulties. Psychological effects. Sudden loss of color vision can be distressing, leading to frustration, reduced self-confidence, or even depression. Management and prognosis. There is no single cure for acquired color vision deficiency, but management focuses on addressing the underlying cause and supporting daily living. Treating the cause. Stopping or replacing a harmful medication, controlling diabetes or hypertension, or treating optic neuritis may improve color vision. Visual aids. Colored filters, tinted lenses, and digital apps can help enhance contrast or assist with identifying colors. Rehabilitation strategies. Occupational therapy, lifestyle adjustments, and using labeling systems can help patients adapt. Prognosis varies. In some cases, e.g., drug-induced changes, color vision may recover if the problem is caught early. In others, e.g., macular degeneration, losses may be permanent. HAT prevention and risk reduction. While not all cases are preventable, steps can reduce the risk or catch problems early. Regular eye exams for people with diabetes, hypertension, or a family history of eye disease. Monitoring patients on high-risk medications like ethambutol or chloroquine. Workplace safety. Limiting exposure to industrial chemicals and providing protective equipment. Awareness. Knowing that color vision changes can signal disease encourages early medical consultation. Research and future directions. Research continues to expand our understanding of color vision and its disorders. New diagnostic tools aim to detect subtle changes earlier. Advances in imaging allow doctors to see cone damage in real time. While gene therapy holds promise for congenital forms, insights into neuroplasticity may eventually help those with acquired CVD as well. Digital technology, including smartphone-based tests and adaptive software, is also making color vision support more accessible. Conclusion. Acquired color vision deficiency is more than an inconvenience. It is often a window into broader health problems. Unlike congenital color blindness, acquired forms can appear suddenly, progress over time, and be linked to serious conditions affecting the eyes, nerves, or brain. Recognizing the symptoms, seeking timely medical attention, and undergoing appropriate testing can make a crucial difference. With proper management and support, people living with acquired CVD can adapt to the changes and continue to lead fulfilling lives.